Welcome to the webinar on employee health and safety in PeopleSoft. Before we get started, few housekeeping rules. All of the audience audio is muted, and hope all of you are able to hear me. And my screen is shared, and hope you're all able to see the screen as well. Please use either the chat or the question window on the webinar tool to raise any questions, or if you're not able to hear me or not able to see the screen. Throughout the session, there will be various logical breakpoints where I'll be reviewing the question and chat and address any concerns, any questions you have. Apart from that, towards the end of the session, we will also have a separate questionnaire time for question and answers. With that, let's get started. My name is Logesh Balasubramanian, and I'm the Managing Director for HR Technology at Sphere. We at Sphere are an Oracle Platinum partner, and we have been established since 2004. And essentially, we are a one-stop shop for everything PeopleSoft. We work very closely with the Oracle team, and we are present coast to coast and work across all the major industry sectors. One of the key differentiating factors about Sphere MC is we do not consider PeopleSoft as a legacy application. As I said, we work very closely with the Oracle PeopleSoft team and stay on top of all the latest and greatest features, application and technology updates for the PeopleSoft application, and work very closely with our customers to get them adopted so customers get the best value out of their investment in PeopleSoft. And this webinar is one such example where we want to highlight all the delivered capabilities of the PeopleSoft HCM application, what it can do when it comes to monitoring the employee health and safety. So hope you enjoy the session, get value out of understanding what is delivered out of the box, and are able to deploy and make use of the capabilities out of the box. With that, I'll get started. Before we get into the detailed discussion aspects, I want to quickly cover what is the health and safety capability in PeopleSoft and what is the background of this functionality. So employee health and safety has been always around in PeopleSoft for a long time now, and it is part of the core HR module, so it does not have to be licensed separately. The administrative functions of this module have been around for all the time. What has changed recently is that as part of the COVID pandemic response, there has been updates to the application to provide self-service capability to this module. What it means is that employees have now more an active role in terms of reporting the incidents. So now this completely opens up the functional aspects of this module, makes it a lot more easier for the organization to collect and manage the health and safety incidents, which is the reason for this session. And we want to highlight the major focus of the session is going to be around what does the self-service capability do and how you can deploy it, how you can expand it. Out of the box, the module functionality supports, for the USA region, supports Osha reporting requirements. In addition to that, this module also comes with a lot of country-specific extension, meets the health and safety requirements, regulatory requirements for various countries that is listed on the slide here. Now, for the scope of this session, we are going to be pretty much focusing on the capabilities for the USA region. If any of you have any specific questions for other regions outside of the USA, please feel free to reach out to me via email. I will be sharing the contact details at the end of the session, and we can have an offline discussion on that. With that said, the plan for this webinar over the next 90 minutes is to start with a bird's eye view of what you can do in the application as delivered, what is the business process associated with it. I'll give a quick overview of both those topics before jumping into the system, and the major portion of the discussion today is going to be an online demo, show and tell, in terms of what is the capability of the application, pretty much from end to end. And then we'll come back to discuss what is the deployment process, and specifically also where we help with the deployment process, and all the references in terms of what you can do next, what are the information available for you to get progressing with this module deployment. With that, I will get started. So first, when it comes to the health and safety module, all the activities in the module pretty much starts with what we would call as incident reporting, where there is a health and safety incident that initiates the flow of actions from there on. When it comes to the incidents, there are a number of types of incidents that are delivered out of the box. Predominantly, they fall under all the health and safety aspects. Accidents I have called out as in one specific item in here, but there are a number of kinds of accidents that are there delivered out of the box. And then injury, illness, and certain variations of them as well. And when it comes to certain specific industries where there are hazardous condition, dangerous occurrence, exposure, or contamination possibilities, there are health and safety incident functionality available to cover those specific areas and any other unsafe practices. Now, the incident type that I'm discussing here is entirely customer configurable. What it means is that you can create your own incident types that could be more appropriate to your business requirements. For example, let's say if you want to set up an health and safety incidents, that could be something like a workplace harassment. Harassment could be a health and safety incident, and this module can be set up to capture those incidents. For employees, provides an easy way for employees to report it and the administrators to manage it. So that's one such example. So it's entirely customer configurable and can meet any health and safety related aspects that are specific to your business. So after defining the incident type, the most important aspect of the module is it's quite detailed in terms of what level of information can be captured or recorded in the system when it comes to the incident data. So let's start with an incident. Almost all incidents starts with somebody getting impacted, either an employee. In addition to the employees, the incidents can also track family members of the employees or anyone who is a non-employee. It need not be any just the family members. It could be a person who was a witness, who was a mail delivery person who was in the building when the incident occurred. Things like that. Any employees and non-employees can be associated with an incident. Any vehicle or equipment that was involved in the incident can be tracked, provided you are already having that vehicle or equipment information set up in the system. If not, you can set it up and track it as part of incidents. And when the incident involves an injury, that's when there is a lot more information available to be tracked in the system. For example, starting with the nature of the injury, the source of the injury, the body part that was impacted, and the subsequent steps. When it comes to an injury, the injury management process is more elaborate. We will see that in this session. And some industries and some organizations have physicians who are in-house as part of the organization. And the physicians can be set up in the system, and any diagnosis that happens as part of the incident management can be recorded in the system as well. And when it comes to managing the incident, starting with capturing the statements of the individuals who were involved, witnesses who were involved, etc., system provides ability to do that. And we will also talk about ability to manage claims and also record the impact, work impact that has resulted from this incident. All of this is possible in terms of recording in the system out of the box. When it comes to the business processes about the incident management, so once an incident has come in, we will talk about the exact flow of the incident management in our next topic. But for now, in terms of what is possible in the module, an incident can result in claims. The claims can be managed in this module. An incident can result in a rehabilitation plan, and these rehab plans for both employees and non-employees can be recorded as part of the module. And there could be corrective and preventive actions to avoid such incidents in the future that can be recorded, assigned to different people, and tracked in the system. And most importantly, when it comes to any serious health injuries, health and safety injuries, the regulatory reporting aspect of it, which is region specific, is also part of this module functionality. As I said, we will specifically focus on the US regulatory requirements and what is available out of the box to meet the Osha reporting standards. But the module also supports various other country extensions if you're operating globally. In addition to all of this, in addition to all those incident management aspects, there is also capability for proactive monitoring, tracking of employee data, employee health related data. So specifically, this comes into use where for companies specifically that have, by nature of their business, is more involved in health and safety of the employees, and also have situations where they have in-house physicians, etc. This module can be used to record the health of the employee when it comes to the ENT aspects, audio, eye, physical exam, respiratory, etc. An organization that do drug tests as part of their higher onboarding process can record their drug tests, and ongoing as part of the employee life cycle, drug tests can be recorded as well. So this section would fall under proactive management, not directly related to incidents, but that's also proactive health and safety management aspects. So all of this together is essentially a sort of the bird's eye view of what can be done using this employee health and safety module. The term module, I'm using it a little bit loosely here. Consider this, it's not a standalone module, it's part of the core HRMS, and it's like a sub-module, part of workforce monitoring functionality, and health and safety aspects of it is covered in this. So throughout this session, I will be referring it to as a module, but once again, for those who are just recently joined, there is no additional licensing requirement to deploy this functionality. So it's part of the core HR module. So you can, if you're using PeopleSoft HR, you can start using this functionality anytime without any additional licensing requirements. All right. With that, I want to quickly switch into the next topic, which is the business process flow of the functionality within the health and safety module, and more importantly on the incident. So we, as I said before, everything in the health and safety module revolves around incident management. And when it comes to the incident management, I mentioned before, there is a new capability that provides self-service functionality for employees now to be able to submit this health and safety incidents. And that functionality is available via Fluid User Interface. So I'm calling it as Fluid UI in here. And it pretty much starts with creating an incident, an employee going into their self-service and starting an incident, providing the details of the incident, what occurred, when it happened, who were impacted, providing any supporting documents like any photos of the incident or more specifics about where it happened, etc., and submitting that information. Now, this piece of functionality is entirely new. As I said before, that's released in PermiMage 36. And starting from this point onwards, all other functionality has been around in this module for a long time now. Along with the part of the self-service reporting is the workflow approval capability. So this actually falls under the newer functionality as well. So when an incident is reported, there is a workflow approval process. As delivered, the workflow approval process goes for approval to the health and safety administrator, but it uses the approval workflow engine, so customers can set it up to use in a more comprehensive way if it meets any further approvals. From that point onwards, once an incident has been created and approved, the incident is recorded into the health and safety module. And from that point onwards, the management of the incident functionality has been around for a long time. The reason I keep saying is that before this self-service functionality was released, typically a health and safety incident would be recorded by the administrator. The administrator would create the incident and take it forward in terms of the incident management process. So their activities will pretty much start from this section where they have received an incident. They now gather more information about the incidents. When an employee reports an incident, maybe not all information is covered. They need to contact people who were around, who knew of the incident, collect more information. If there is any injury related with the incident, then gather a lot more information about the injured person, the nature of the injury, how the person was treated, etc. Later in the process would come into the claims management will come into play. It's not immediate, typically not immediately associated with an incident, but an injury could lead to claims, and the claims can be recorded and tracked in the system. To put it another way, a claim can be a reason that an incident may have to be created in the system. In some cases, the injury would not have been reported, but a claim may come in that may need to be going back and that may lead to going back and creating an incident to associate it with the claim. The system supports both these options as well. For customers who are interested, they could also, when there is injury involved, they can also have a rehabilitation plan in the system, both for employees and non-employees. Set up also corrective and preventive action, assign it to people, track it. All those would follow typically with the managing that particular incident. And finally, the regulatory reporting aspects. Now, the last four processes, sub-processes in this section, when it comes to claims, rehabilitation, corrective, preventive action, all those are optional, right? Depending upon whether you want to use it, whether it's applicable for a specific incident. So all those are optional. And regulatory reporting as well is only mandated for certain kinds of injuries. There are requirements by industry. So regulatory reporting aspects would vary as well. And it's typically related to incidents that involve an injury. So, or a serious injury for that matter. So from an end-to-end process point of view, these are all the steps that forms the incident management functionality. With that, I will switch to the online demo portion now, where we'll go through each of the steps and what are the possibilities of deployment, what you can use out of the box, and how you can extend these functionalities. Before I switch to demo, let me just quickly have a look at the question and chat section to see if there are any items in here so far. I see one question. Just give me a second. Are we able to get copies of the PowerPoint presentation? Absolutely, yes. So after the session, I will be sending out a printable copy of the presentation. Has a lot of useful information that we are going to cover after the demo as well. So we'll definitely do that. So far, that's the only question I see in here. I'll just remove that. Just give me 1 second. All right, there is one more question. Are non-employees set up as POIs? No. Specifically for this module, non-employees are just created in this module. They are assigned a non-employee ID, and there are different types like witness and other types that you can use for. So a unique identifier is created for a person, and that is used specifically in this module. So a non-employee is not set up as a POI and doesn't get involved in any other functionality, interfere with any other functionality you use in the HR module. Does this use guided self-service? No. We will talk about that when we get into the demo, but the answer is no. It uses activity guides, and it has a guided process, but the guided self-service is a separate framework that also uses activity guides, but these two are separate items. I see that there is a question about a technical issue, and I'm guessing that is user specific because I'm not hearing from anyone else. So hopefully that user, if you're still having any issues hearing or seeing the screen, maybe please try logging out and logging back in. All right, so with that, let me remove these items in here. All right, please continue to use the question section. If you are using chat section, I would recommend please go to the question section because that's easier. I can see all of the questions in one place. Excellent. With that, let's get going to the demo aspects of the application. So for the demo, the plan that I have for today is there are going to be various aspects I'm going to be demoing. So I'm going to move from one section to another after I cover all the topics in that particular section. Upfront, I want to start with the self-service capabilities of this functionality, especially the recently delivered fluid self-service capability to report an incident. So for that, I'm going to log in as an employee. This is the latest demo environment, image 36. Of course, 37 is out, which probably has some more add-on capabilities. But for this demo, I'm using PubImage 36. And mostly everything that you're going to see here is configuration driven on the configuration done on the latest PubImage. So as you can see, I'm on the employee self-service homepage. There is a health and safety tile in here. So I go into the health and safety tile. This is the place for an employee to come and report an incident. Now to start an incident, the employee first chooses an incident type. I'm going to, for this demo, I'm going to be showing 3 different incident types. Of course, as I said, incident types are delivered out of the box. Customers can add their own incident types as well. So I'm going to pick up a delivered incident type, couple of them, and then I'm also going to show a customer setup incident type as well, and what all to show how all it can be extended, what are the capabilities of the module. So to start with, let me start with an incident. And you can see then it could be an incident that could result in an accident, or it could be an accident, or it could be an accident that could result in an injury. Those terms are interchangeable, so you could review this list and make it simple as well. You don't have to have all these options in here. So in this case, let me start with an injury, because I know some person in my department is injured. So let me come in, and it could be me myself. So I start with trying to report an incident. So in this case, let me make sure you're seeing a large screen, 100%. With the incident report, one of the question was, does it use guided self-service? As I said, as you can see in this screen share here, this is an activity guide that shows there are 5 steps in this process on the left-hand side. As it is an activity guide, you can change it via configuration to add more steps or reduce steps as needed. But I'll first show you a delivered example, and I'll also show you a customized example. When I say customization, done through configuration. So in this case, let me start with an injury, and an injury is okay, injury lifting a printer in the mailroom. It happened, let's say it happened yesterday, and roughly around 2 p.m. Whatever time zone works, so starts with PST, and where it happened, workplace, corporation headquarters. So it can be an off-site injury that you can record, or an on-site injury. So and when you choose workplace, then it allows you to choose from the location setup which office building that you were when this injury happened, and you can be more specific. Let's say level 3 copy room. So to be more specific about the injury itself, when you choose offsite, then the system allows you to enter the address manually. You can record the address as well. First starts with the identification of where it happened, when it happened. Then what kind of, so I chose injury, but whether if it was an incident, whether it resulted in injury or an illness. In this case, I started with an injury. So let me go proceed with the injury. Let's say fell down. What is the description? Fell down and broke the ankle. Looks like it's a nasty injury. Treatment received. I'd say, let's say, hospitalized or medical treatment. I'll go with hospitalized. Now, all these things that you're going to see here is, as you can see, is a picked list. So it's all entirely configurable. We are looking at the demo data, so you can set it up as it's going to be appropriate for your use. And since it is an injury, I get to provide more information, like what body part was impacted. In this case, I said leg, so let me go with foot. Nature of the injury, cut, laceration, puncture wound. It could be a broken bone, could be a nature of injury. All of these items are configurable by region. So one of the important aspect of this module, health and safety module, is it is fully controlled based on regulatory region. And for reg region USA, for example, you get to set up all these variables, and you could change all of that for another regulatory region. The reporting requirements is definitely going to vary between different regions. So the entire module functionality is driven based on regulatory regions, establishment ID, and location. Those 3 aspects of the core HR module plays an important role in this health and safety functionality. With that, let me go and add some more information. Source of this, cabinet, file cases. I'm just picking the items that are close to what I have said in terms of an injury that's related to lifting a printer in a copy room. So let me say overexertion and lifting an object. So I get to provide some more information to qualify that injury. All of this is going to come in terms of comes to help with reporting aspects. So that's why we're capturing this information. I get to add people who were involved. This is the section where you get to add whether a workplace contact was involved or a non-workplace contact, like a non-employee is the second section. So let's go in here. I would say, okay, I think I typed in the name wrong. So we'll wait for that to come back. Or I could use the lookup glass, go through the list of employees, do a filter there and come back as well. Either option is fine. In this case, I'm just typing in a name. Just give me a second here. I think maybe I should have better used the pick list option there. That would have been much easier. Anyway, so it's back now. For Rosanna Channing, let me say she was a witness. She's probably my colleague, and she's a witness for this. Let's say start happening or helping me or something like that. Or could be a person who was providing first aid. Any of that information. If I want to add a non-employee, I basically get to record a person in here. Let's say I'll just go with my details in here. And this person was a bystander, and I could say mail delivery guy. And the only reason you would want to add any non-workplace contact is if, like, for that person was impacted. If he's just like a bystander, I don't think it is needed absolutely. So it all comes down to what exact details you want to collect. As I said, I have the ability to add any supporting document. So maybe someone took a quick picture of it. I could add a picture. In this case, let me just attach a random picture in here and upload that information. I can provide a quick comment in here. And review and submit all of this information. As I said before, this is using Fluid Pages activity guide. So all this information that you see in here are configurable. I'll quickly switch to the next one and show you how a configured example as well. So that's one example. So let me submit that one. So this is a standard delivered usage of the incident reporting of how an employee would submit an incident. Now let me show a quick example of a completely custom incident type that I have set up to show how much, how powerful the functionalities are for you to play around in terms of to capture any other additional information that you want to. So for that, what I have done is, one of the primary reasons for this webinar itself is how you can use this functionality in response to COVID. And for COVID, one of the delivered option is the COVID illness. So if you choose an illness as an option, in this case, I'm just using another delivered incident type. Illness is a delivered type. I could say COVID positive. So let's say an employee wants to report a COVID positive situation. So he's just selecting that he's COVID positive. Let's say the tests came out earlier in the week, and it happened off-site. There is no specific address in here. And let's say tested it. So when they choose illness as a type, they could choose COVID as a type in here. Of course, all of this is configurable. You could, all the other illness types were earlier available. COVID was recently added. So you could try to track any kind of illness that that you want to track in this application. So say multiple tests. So I'm just trying to keep it quick here. Multiple tests confirmed positive. Treatment received, did it need any hospitalization, etc. But in this case, let's say it's a pretty mild symptom, so we can keep it none. any other information about body parts impacted, etc. So in this case, if it's going to be like most cases, if it's going to be mild symptoms, none of this information would be needed. Anyone else was involved, and no, this was just a COVID illness that an employee got. Maybe let's say they need to attach an example of a positive test certificate that you want to collect from them. So let's say I want to attach a document in here and submit it. So this again is a delivered functionality. So you're basically submitting an illness, and COVID-19 is set up as an illness, and the employee is submitting this information. And but what I want to show you next is a completely custom in terms of a new incident type defined. In this case, to do for employees to report whether they have vaccinated or not. So of course, COVID vaccination, unlike any other vaccination, COVID vaccination is a health and safety risk because of impact to other potential employees they come into contact with. So if you want to track COVID vaccination, you can set up that as a separate incident type. And in this incident type, what I have done is I have tried to use various other delivered capabilities to show you what all you can do with this functionality, right? So for example, you would notice the incident type page looks slightly different in here. So for example, earlier the date was a standard date field, like a date when the incident happened. In this case, I have relabeled it saying that it's a final dose date. I have defaulted a question here to say, have you received both doses? I have hidden some information. For example, the time field that was available here, I have hidden that. All these three things are basically done using the page and field configurator. So it's basically a delivered functionality that you can use to change the look and feel of the page. There's no customization involved with that, no technical customization. So it's basically user can define, I want slight changes to how the page looks. So you can do all of this ability there. You have ability to do all of this functionality. And what I have done here is, since it's COVID vaccination, let's assume that the organization is not doing it on site. So I've defaulted it to workplace, defaulted it to, no, I actually haven't defaulted it. So it could be an offsite or where exactly you did it, or an on-site location. So it could be either of them. But most importantly, what I have done here is I have added an additional section at the bottom of the page to capture the vaccine details. Now, this functionality is not delivered out of the box, and this is being done using the fluid drop zone feature, which is another capability to add more information to delivered pages. Now, for those who are not familiar with the fluid drop zones, essentially you define a page that has all the additional information you want to capture, like the fields, and you can tag it to any delivered pages. What it allows is your custom information is not directly added to the delivered page. It is kept isolated in a separate place, so that when this is a new functionality, when Oracle releases an update to this page, delivered incident reporting page, your customization won't get impacted. So I have used the fluid drop zones here to capture the vaccine information. So this vaccine information, I have set up some vaccinations in here. Let's say Pfizer, whether it's a Pfizer vaccination or a Moderna vaccination, or what other types are going to be available in the future. Let's say I took 2 doses of it, and I can record when I took it. And this whole information, the section that you see under vaccine detail, has been added without customizing the delivered functionality using the fluid drop zones. Now, where I'm saving this information, I'm actually storing it in the employee health card. So employee health card is one of the aspects I discussed very early in the slide deck. You can collect proactive information about employees. Health card is part of that. We will see what are all part of the health card. Immunization is part of the health card, allergies and stuff like that. So I will quickly show how the health card looks as well. So I'm collecting this information as part of the incident, and I'm storing it as part of the employee health card for record keeping purposes. So let me proceed to the next step. In this case, did the vaccination result in an injury or not? No, it did not. So let me click next. Do I have a proof of an attachment? And in this case, let's say I do have to show some proof that I vaccinated. I'm actually not making it up. So let me upload some information in here and submit it. But if you notice one other thing, the activity guide has only 4 steps for this particular item, because in this example I also want to show you what you can do with the activity guides. So you can, the step that I removed was workplace contacts. So let's say when you want to record a vaccination and there is no need to report any other person, so I've removed this step. What it makes it easier for the employees to report this information. They don't have to go through 5 steps. So if you want to consolidate that some of this, then you can do that as well. Another example use case here is, let's say you want an employee to acknowledge something about that what they are telling is not a lie. So they are telling a true information. You could add an acknowledgement into the activity guide. So using the acknowledgement framework. Let's say if you want to add a questionnaire using the questionnaire framework, you can easily add it to the activity guide. So activity guide is quite powerful. You can bring in all those capabilities into the incident reporting pretty much entirely through configurations. Without touching a single line of code, you'll be able to do all of that. So let me quickly submit this one and complete this. So as this example employee, I have come in, I have reported an injury, I have reported an illness for COVID positive, and then I have reported a COVID vaccination as well. All of the status right now shows submitted. So what information you see in this screen is pretty much what an employee can do from an incident reporting standpoint. I see a few questions here, so let me have a quick look at these items and address those before we move on. For people connected section, can we delegate to the actual person so that he or she can record as a witness instead of the other users commenting on it? So as delivered, it is not possible. It is a one user activity. So when an employee, whoever is reporting it, an employee, let's say if a person was seriously injured, that person themselves could not report it. The person who was nearby, the colleague could report it. They could call out who was the person who was impacted. But an incident reporting is a one-person activity, is not a multi-user activity. When the incident has been reported, when it goes to the administrator, they could then contact other people to collect additional information, but they wouldn't be, other people would not be directly add on to that incident. That capability is not available out of the box. The only people who would see this incident is the person who is reporting it, the person who is approving it, and the person and the health and safety administrator who's processing it. No other person like who is added as a witness is going to be able to see that. Okay, so that's one question. I see there is one more detailed question in here. Actually, a few more. Just give me 1 second. Oh, so the second question is, instead of the employee entering information, can the system be configured to allow a member of the company's health safety department? Of course, yes. That's the health and safety administrator creating an incident was the functionality, or still is the functionality that has been available all the while. This self-service functionality that I'm showing you is a new capability where an employee can initiate it. They could provide bare minimum information. Once it goes to the health and safety administrator, they could fill all the more details, which is what we are going to see next. So I'll cover those aspects in a little bit more detail when we get there. And the next question is, instead of having employee enter information, can the system? I think that's what we covered. Okay. What happened when the management wants to upgrade the image and we did this new config as part of the custom requirement? No impact at all. So the configurations I showed you, for example, if you're just adding a new incident type, there's not going to be any impact, whether it's a tools patching, tools upgrade, or an application patching. No impact at all. Even if you're adding things like page and field configurator, drop zones, activity guide changes, none of that's going to be impacted, because all that you are doing is adding, all the changes that you would be doing is add with new effective date. So your configuration data will prevail, provided it's done in the right way. If you're not updating the delivered config and just creating a new effective date, and all that information would prevail. All right, with that, let me log out as this employee and go to the next step. Can we migrate configuration? Yes, absolutely. There are multiple ways to migrate this configuration. One is the standard data mover script way, which means you need to know what tables to migrate. But the more easier way is the migration workbench and the application data sets. So you would use the data migration workbench and application data sets to migrate some of these newer configurations like the activity guide, page and field configurator, etc. Okay. All right. Keep these questions coming. Let me move this question away so I can focus on the new ones. All right, so what I'm going to quickly do next is show what the approvers see. In this case, as delivered, as I said before, the approval has been set up as a one-step approval, which is goes to the health and safety administrator. But as I said before, it is AWE, and you can set it up like, for example, if a manager or a department admin needs to be notified about an injury, you can maybe set it up as just a notification. Or if you want your manager to approve something before it goes there, typically you wouldn't. There is no business need to do that. So you could set it upon based on your business requirements, whichever way you want. In this case, there were 3 incidents that I submitted. So let me go through and review what I can see in here. There is some basic information shown to the approver, but they can always click on the incident details to see pretty much the entire information. So you can see here as an approver, I'm able to see all the data, incident details, location, the questions they answered, additional informations they added, workplace contacts, other contacts, including the attachments. All the information is available for the approver to review and say, process. Now, this just to be clear, this incident approval is an optional activity as well. For example, let's say you want the health and safety administrator to basically just receive and process them. There is nothing to approve. Then you could disable the approval and just directly get the admin to do their activity. We will see the admin activity next, but I'll just quickly go through and approve this information. So the entire content that you make available, that you have on the incident reporting, is available to the approvers. We already see that. So let me quickly go through this approvals. So as an admin, I have gone through and approved all the incidents. But before I go on to show how a health and safety administrator performs their tasks, I want to quickly cover the aspect around the incident reporting where I spoke about how I have customized a lot of functionality for the COVID vaccination tracking. So everything starts with first defining our own incident types. So in this case, let's say COVID vaccination is an incident type that I added. So incident type is a translate, standard PeopleSoft delivered translate page. And you go in here and you're adding a COVID vaccination. You can add any number of incident types as you need here. So first starting with an incident type. And there is specifically a page as part of the new self-service functionality that allows you to configure the incident types. So once you have added the incident type, let's say COVID vaccination, you come into this page, define how the self-service functionality should work for that incident type. So in this example, first you choose whether this incident should be available for self-service reporting. You can decide an incident type to be only available for administrators to report, not for employees to report. So maybe something is sensitive. You want to not have a self-service reporting functionality, but just an admin to do it. You can do that. Whether it should have workflow approvals. There is, as I said, there is a delivered workflow AWE process ID for incident reporting, within which you can have multiple definitions. For example, let's say for injuries, you want the workflow to behave certain way, and for illness, you want to behave in a certain way. This is where you would control that. By incident type, you can define your own approval process, whether you want to enable email notifications, push notifications, etc. Same is with the activity guides. Activity guides is going to define the number of steps you saw in the incident. So there is a delivered activity guide category that's for health and safety incident reporting. Within that, there is a delivered template uh, that I have cloned. In this case, the delivered reporting incident is the first one we saw that had 5 steps in it. I have cloned it and removed one of the steps for reporting vaccinations. So this is what you can do. So this items, both these items, AWE, activity guide templates, are all configuration items. Now, it gets a little bit more technical for some of those configurations, so I don't want to spend too much time on that. But those are all configurable frameworks where you basically go in and add, remove steps that you want to do. So that would be under the activity guide and approval process, etc. I did talk about the page and field configurator where I have enabled, disabled some fields and changed labels. That I'll just quickly show you that how easy that one is. So when it comes to the incident reporting, so you can see here I am controlling the display of the incident reporting page based on the incident type. So for incident type Z, which is my COVID vaccination, I'm saying that I want to change the display of the fields. I want to hide the field address, address long field. I want to hide the field name. I want to change the description of the field incident date to final dose date. I want to add a default value for this description field to have a question there. All this is very basic configuration, and that is done specifically for that incident type. And then I'm saying for the other incidents, I just don't want to do something else. For all other incidents, I want to hide the COVID vaccination section. So I'm basically doing that. So the look and feel of the page is all controlled by a configuration in here. This is all optional. You don't have to use the page and field configurator or the activity guide changes to use the delivered functionality. This is to show how you can extend the delivered functionality, just so that you're aware. All right. I think to keep us within the time limit, I don't want to spend too much time on the other configuration items, but these are all other possibilities to extend the functionality. Before I switch to the health and safety administrator activity, I'll just take a quick look at the questions here. Can we able to add self auto approvals for certain incidents? Of course, yes. It's AWE and you can do that. How long does it take to implement, and what are the benefits of using? Okay, this one we are going to talk about that, and this is fairly straightforward. We will go when we get after we complete with the presentation. When we go back to the slide deck, there are specific topics that are covering the implementation aspect, so we'll cover that aspect in there. Okay, excellent. So now let me get out of this and sign in as the health and safety administrator. So for the health and safety administrator, what is delivered out of the box is there is a fluid tile manage health and safety available as part of the workforce administrator functionality. And within that tile, it takes you to the dashboard, the manage health and safety dashboard. And the health and safety dashboard has these 3 navigation collections at the top: managing an incident, reporting and integrations, and then configuration. So basically the 3 key business functions are grouped under 3 different navigation collections in here. But before we get into that, I want to quickly highlight, since it is now fluid and you have collected the information, you now can report that information in whatever aspect you want. So what we have done here is shown a couple of examples of how you can report this health and safety information. First one is the incident summary analytics. As you can see here, it shows the incident summary based on various incident types. And the breakdown within the incident type is by location. For example, I'm looking at the COVID vaccination and I'm looking at the Illinois operations, or a COVID vaccination in Delaware, etc. So once you have all this data collected, then basically you can use it in a more meaningful reporting way that's going to suit your business reporting requirements. I can deep dive into the same information. It's a pivot grid based analytics, so standard pivot grid analytics functionality applies. You can mix and match. Let's say you don't want to look it by locations, you want to look this information by department, company, you can do all of that. You can just play around with all of that information. This is purely an example, and none of this requires any technical coding effort or customization. You're basically creating a query, a PeopleSoft query, then creating a pivot grid and deploying it as an analytics on the homepage or a dashboard. So you can easily do all of this via configuration. And this is just to show what is the possibilities that you can have when you roll out these functionalities. So in addition to just seeing this information, for example, let's say COVID vaccinations, there are 19 COVID vaccinations. I can click to see, I can drill down. I just want to look at the COVID vaccination information. And if I want to go and make use of this, so if let's say I want to go and look at the details of this, I can click and say, I want to go into the incident details, takes me directly to the incident details page. We will see the incident details page more detailed as a health and safety administrator, but I just want to go back one step. And another interesting analytic that has been created that we have done is the COVID vaccination summary. So this information is essentially to track the COVID vaccinations based on certain parameters. It could be by locations, it could be by departments, etc. So as you can see here, this particular analytic is showing the information by location. I think I did press it a little too early before it came back. Yeah. Okay. So the information that is shown here is, let's say you have a different number of employees in various locations. The line at the top is your actual employee count by location. Since this demo environment, I'm just picking up a particular company and showing you an example. Let's say California has 5 employees, corporation has 46 employees, the headquarters. Now, the second line is the number of employees who have been vaccinated in each location. So the California, nobody has vaccinated yet. And headquarters, 5 people have vaccinated out of 46. So you can fairly easily see how your various locations are progressing with their vaccinations. And in this case, when it comes to the Illinois, the operations are all 4 employees in that location have been vaccinated. So you're able to see those variations, how different regions are progressing. And the information I said, when it came to vaccination, you can then play around with what type of vaccination they received, etc. But I also wanted to quickly show you where that information about the vaccination is stored. So as I said, there is a health card functionality. Now, as an admin, I'm only going in as a view-only user. This admin does not have access to enter the health card. This particular user I have logged in as only has view-only access. So the health card has various sections in it. This is a review page, and it shows the employee's address, what is their employment, any physician information if the organization is storing that. And the core of the health card is this information, the drug sensitivities the employee may have, any other tests that they have had in the past, allergy details, immunization detail. So this immunization detail as part of health card has been around for a long time. What I have done as an extension is for the information that is collected on the incident report to be added to the immunization record here. So this person reported they got the COVID vaccination dose, just 1 dose, dose 2, basically some test data, and that is recorded here as part of the health card. This is just to show you that you can do this. You can keep the incident reporting to just being able to record whether they got vaccinated or not, or you can extend it to say you want to collect what vaccinations they took and store this information. Now, this capability, this extension of storing this immunization is using the drop zone feature I told you earlier. So we added a separate vaccination functionality to the incident report and then wrote the code to store this information here. Though it's a code that we wrote like a custom code, it's a standalone piece. It doesn't interfere with the delivered functionality. It's a part of the fluid drop zone. Henceforth, when you do any patching, those things won't get impacted. Okay, so this is to quickly show you where that information gets stored. Okay, now let me quickly go back to the admin homepage. And let's start reviewing the admin activities, health and safety administrator activities as part of the incident management. These navigation collections here are all security controlled. The user that I have logged in as have the ability to manage incidents for the USA region. So they are not seeing any other country extensions. So let's quickly review what all information is available. So as the new user, we submitted 3 different incidents. Look at the sequence in here. There were some old demo data in here, ignore those. The sequence that are shown as 100,000 and followed by this last 2 numbers, those are the incidents that are getting newly created. So 30, 29, 28 are the items that I recently submitted as an employee. COVID vaccination, we already saw that. The incident basically covers that information that the COVID vaccination happened. There is not a lot of other information we have collected here. The immunization, I showed you where that information got stored. But let me pick up a more detailed item, the injury one, the first incident that I submitted, which has all the other items that I want to talk about. How to manage an incident that has injury in it. So in this case, as you can see here, this is an injury and resulted in injury or an illness. Whether it has been investigated, let's say we mark yes, it has been investigated. We are doing investigation now. And who were notified? In this case, the person who reported was Cynthia, and the person reported to was the person who approved it. When I approved it, I was logged in as David, so it shows me the time. So it shows me who approved it and the time when I submitted it. This server is in a different time zone, so it's showing a different time in here. That's the time it was submitted. And what is the description of the injury? Injured lifting printer in the copy room. This is where a health and safety administrator will come in and say, have a phone call with a person who was impacted or a person who was nearby, and add more details in here. So the person employee was, let's add something. Say employee was attending to a printer issue and tried lifting it, etc. So a bit of a story around what happened so that you can document that information. Where it happened, since I chose an office location, it records that information. It shows where this happened, the comment that was put by the employee. If the incident is part of any travel, then you can add all of the travel information. What was the flight itinerary, when it happened, all of that. But in this case, we'll just skip through that. We are not going to cover that level of detail in here. Was there any other people who were involved? This is the people involved section where it shows the non-employee. I typed in an employee name and it created a non-employee ID for me, basically for record keeping, like a unique identifier. I can now talk to the person and say, okay, was this person responsible? In this case, no. Let's say he's able to answer questions about what happened. So let's say that's his role. And the other person was the manager or my colleague who was there. Then let's say this is a trustworthy person. I don't think it really matters in here. Or in case of, let's say, driving related incidents under the influence of drugs, etc., all those things can be recorded. And finally, what is the reporting that you want to use? In this case, this is USA regulatory region. So that's the reporting that we want to use, and it shows establishment. So as I said before, when it comes to OSHA reporting, there are 3 key things. We need to make sure it's available. We need to make sure the regulatory region is USA. We need to make sure an establishment is entered that is associated with the location, because the reports, all the regulatory reports are driven using the establishment. So I'll just add that information and make sure this is reported. Let's say we haven't reported it. Let's leave this remaining section blank. We will talk about how the reporting happens. Now, let's say we have covered the basic incident details. If we need to go and cover any other vehicles that were involved in this incident, in this case, it's an office incident, no vehicle involved, but I'll just quickly show you this vehicle page. So once you have set up your company property, which is part of the core HR, you can add that information to this list. So if you are operating industry vehicles and it's part of the system, then you can record all of that information. In this case, I'll just randomly pick a company ID property that was set up, so that gets added. There's no specific business process associated. You are basically using this for record keeping. Any damages and that might have happened to the vehicle and insurance details. If you want to record all that information, you can do it in here. Then comes the injury details. Now, injury details is extremely important, specifically for if you are going through to you are using this for OSHA reporting purpose. In this case, let's pick up our injury. Let's make it like an injury that we need to report to OSHA. In this case, could be a serious injury. So let me pick up our injury here. We have the information about when it happened, who was the person involved, etc., all coming from the incident details. Then we talk about the injury itself, what happened. In this case, hospitalized, injury, illness details. We can add more information here if needed. If there was any statements that we want to cover, what happened, if you want to collect statements from the injured party, other or employer or any other person, you can collect that information in here. What are all the impact of the injury? Like for example, body parts, nature, source, all this was filled by the employee itself. So all of this information is available. If not, this is where the health and safety admin would be filling this information in. Was there any unsafe act performed? In this case, let's say unsafe position or posture. So let's add that information in. First aid, patient taken to the hospital. Let's say ambulance was required. Any other information we want to add here? Let's say the first aid was given, who gave the first aid, etc. All that information can be added in here. So let me just quickly add that. So Channing gave the first aid, and what was the first aid? Cleaning up and blood loss, something of that nature. So let me save that information. And diagnosis, this typically happens later. Let's say if the physician is in-house and this person was treated, you can add more information. Or if it was a person, if the treatment happened in the hospital, you can come back and add other information by talking to the employee. Now let's talk about the work impact of the injury itself. In this case, this injury, this resulted in, let's say, a serious injury. A person broke an ankle. So obviously there is going to be an impact on the work. So let's quickly cover what was the last date. I think we said the person got injured yesterday, and it's going to be at least a couple of weeks of absence. Let's put it like 3 weeks. We don't have to cover that information. Injury resulted in termination or transfer. Not often. If the person it's a fatal injury, then termination, but typically transfers. If the injury is a long injury, a long-term injury and transfers are needed, that's when you would record this information. And that should be it. In terms of work days, if we want to cover more information, we can do that. So let's say the person is not going to be available for 3 weeks. So let's add more information. And away from work due to injury. So rest needed. And save that. Now, when we do this, this is when the impact around the work impact gets calculated. So from an OSHA reporting standpoint, this is days away as of today. The person is expected to be 23 days away. So this is going to come into the OSHA reporting aspect. And when we go into the next section, as you can see here, the case has been marked as reportable because there was a work impact. There's an automatic assignment of the case number that auto increments. And if you are filing it immediately, then you can mark the date filed. Now, depending upon the industry sector, the size of the organization, I think the limit is if it's less than 250 or more than 250 employees, their reporting requirements vary. Some have to be filed within a certain limit. Also, it varies by state. And some can be annual filing. All those informations vary. So the health and safety administrator will make a decision whether they are filing it immediately or filing it, or waiting and filing it later. Okay, it cannot be in the future. So I can file it today or later. Specifically for the OSHA reporting, there are other information. Let's say if there is any long-standing impact that can be marked here. So let's say this is a temporary limp for few months, something of that nature, if we want to record. So this injury maintenance is a critical piece around the regulatory reporting aspect. So this I wanted to spend a little bit of a time on that. So let me see if there are any questions. Nothing so far. So let me continue with moving forward. Now, pretty much from regulatory reporting standpoint, you can now move on to generate the OSHA reports if needed, or any other internal reporting aspects. But the other aspects, like when it comes to claims management, rehab, entirely optional, depending upon whether you want to use or not. But in this case, let me quickly show you what is available. In this case, let's say a person got impacted and they want to submit a claim for due to a loss of work, or you basically want to track that information, any monetary information, either direct or indirect costs associated with that injury. Even it could be vehicle-related costs, insurance costs, anything that you want to track that is to be associated with that incident. You basically do it on the claims page in here. Starts with a claim. Claim number can be auto-assigned, or you can manually assign it as well. In this case, you're starting with a pending status. Who was impacted? Let's pick up our employee. I forgot the name of the employee. I think it was Cynthia. No, sorry for that. Let me quickly go back. And our injury was for Cynthia Adams, but it's a different employee ID. Okay, so let me go back to open a claim in here. And the employee who was involved was Cynthia Adams. And when I choose the employee or a non-employee, that is when I can choose an incident, because the incident is filtered by the employee who is impacted. So in this case, we know the person submitted one injury and one illness. The claim is associated with the injury, and we can say that the claim is being investigated. Or if the claim comes pre-approved, we can approve it as well. So we can use all of that information. For the USA section, it shows the OSHA case number in here. And then you basically go into the details of what are the costs that are being claimed and what is getting approved. All that information can be captured in here. If you have specific providers for work and safety, then you add that information, who is the claims manager who is working on the case, etc. So claims management is all around recording the claims process in the PeopleSoft system if you want to report out of that. So there are a couple of claims related reports as well that you can use. Now, again, all these functionalities are used at different levels in different industries, so not applicable for everyone. So I don't want to be spending too much time on here. So that's the comprehensive use of the claims functionality. Okay, let me go back and save the info I entered. So there is the claim number, and then I can go in and create a rehab plan. We know this employee got impacted with an injury. Let me pick up this injury. There are two incidents. I'll pick up the one that I know resulted in a claim. It already picks up the claim number. The claim itself is pending. I can update. The rehabilitation could be related to the claim itself, so that information is shown here. We already covered the return date of the employee. Now, the health and safety administrator can enforce, not enforce, but essentially recommend when it comes to work restrictions and modification. Let's say this person resulted in a broken ankle. This incident resulted in a broken ankle. So let's say we want to enforce a restriction that says cannot climb stairs or cannot lift weights. All this is configurable. What options you see here, all of this is configurable information. So you can set up the items to suit your requirements if you want to go into that level of detail. So let me just quickly submit that information for a month or so. We don't want that employee to be using any of that. But let's say, what is the modification? So for this person who's impacted his leg, let's say we want to relocate him to the ground floor. So technically not transferring him, we are not moving him out of the department. We are just basically moving his desk to ground floor so that it makes it easier for him to work from the office itself. So let's say we want to do that for a few months. So you can record, so this is the level of details that you can go to in terms of managing the health and safety incident. So you can enforce restrictions, have modifications, and have a more detailed rehabilitation plan as well. So physiotherapy, medication, all this list is user defined as well. So you define all of this. It could be in-house physician or an external person who's going to be monitoring it. Maybe the person's manager needs to be the one who needs to be monitoring all of this information, making sure the person goes through these rehabilitation before fully resolving that injury or the impact of the injury. So all that is possible in here. All right, so that's the rehab. The same functionality is available for non-employees. If you want to track that, let's say if it's a family member of an employee or any other person like a mail delivery guy, and if you want a rehabilitation plan, you can track all of that information. And one of the other items that's associated with the incident is corrective and preventive actions. In this case, let's say this injury, what are the things we can do from it happening again? And who that we want to assign it to. For example, in this case, it's an injury that resulted in a particular employee getting impacted. So let's say inadequate help for heavy lift. So the person tried to lift a printer and had an injury. So the hazard there is inadequate help for heavy lift. Of course, customers define the hazard list and manage that. So the person who's going to be responsible to do it is, let's say it's an operational person, and what we are trying to do is install protective equipment. So or utilize, let's say in this case there was nothing to lift, so installing protective equipment. So that's a corrective action. And if there is a preventive action, of course, I think the action I chose was preventive for it to be happening in the future. So I would actually enter that information here. But corrective action could be anything that to fix the immediate issue. Let's say the floor was impacted and the flooring needs to be redone, things like that. So you understand the gist of it. You can collect and track both corrective and preventive information to manage that incident. So that's pretty much covers the entire functionality around managing the health and safety incidents. I think I've covered it quite comprehensively. There is a question there, is everything you have shown for health administrator delivered? Yes, there is nothing here that is custom. Everything is delivered out of the box, and all this is customer configuration. What I showed you is demo configuration. The incident, apart from incident types, we went through a lot of things like nature of injury, source of injury, corrective action, preventive action, diagnosis. Every single item of that is customer configuration that they can build and maintain. And there was a question earlier about whether non-employees are managed as POIs. I said no, and this is where it is. So there is an employee page where we shows the existing employee and their employment. That is standard. There is a family page. You can add an employee's family member as part of, because it came out as part of the incident. Or in this case, let's say I had my name entered. So I know there was Logesh was marked as a non-employee who was involved in the incident. So the non-employee gets created automatically. I didn't enter any details, but this is where a health and safety admin can come in and collect all this information. So when an employee reported, they just reported saying that this person was involved. Now this person can be contacted, fill in other details. If you want to go ahead and track this information, like if a person was seriously injured, though not employee, you want to track all of that information, you can go ahead and collect and manage this data. Okay, that's the question. Is there a note page or place to save doctor notes? That would typically, when it comes to doctor notes, it would, depending upon whether it is around the treatment itself, it would then fall under the injury details section. You can go into the injury details, and in the details, let me add. You would typically put it in the injury details in here. If it is more part of the rehab or corrective preventive actions, then you would cover it in those pages. However, now the other part, I think pretty much I've covered everything that is in here in terms of case managing an incident. I want to quickly show you when it comes to reporting and integration, there are a lot of delivered reports that are essentially BI publisher PDF reports. So all these reports you see in the first section here, claim summary, employee incident, all these are queries, BI publishers that prints out a PDF form. So you can modify it to suit your reporting requirements. There is a bunch of OSHA reports, as I want to quickly show. So when it comes to OSHA reporting, there are few options in here, not options, few delivered reports available in here. The 200 log is in sort of an archive reporting format, so we'll not spend too much time there. The 300 and 301 are critical. 301 is the individual report for a particular injury. So let's pick up the injury that we just did and choose to create a report. We know that the report was 28 was our new injury. Now this page is to specifically store any additional information about that injury that you want to use in the OSHA reporting, OSHA filing. So for example, it starts with whoever is the person filling it up. In this case, let me say Betty. What's my title? HS admin. And what's my contact number? Yeah. And what was the treatment? If I need to cover, if all this info that you include here is going to be in the report that you're filing with OSHA. That's why this is separate. So let's say who was the person treated. Let's say it's Kaiser. And if you want to include any doctor-related information you want to add, whether it was an emergency room, whether it was an overnight hospitalization, etc., you can include that. The details that you want to report, once again, to OSHA, that's more detail that you want to have a place. This is the location you will capture here. What happened and what was the employee doing before it happened. So things like the health and safety admin has done their review and want to include more detailed information about what happened, unprepared movement of heavy equipment. What was they doing before the incident? Standard working. Right. So this is where any doctor information or any other information that is more specific to that incident can be added. So you save that information. Under miscellaneous, you have more about nature of injury, what caused it, etc. So when you have entered all of this, then you get to generate the 301 OSHA 301 report, which is another BI publisher, App Engine BI publisher. I'll show you an example of how an example report looks like. You can generate it for one incident. You can generate it for multiple incidents, multiple establishments. There are various selection parameters to generate this report. So you can do all of that. Of course, there is for companies that do year-end filing, if we go back, there is an annual log summary 300A. And also 300, which is an incident log. So these options are available. I think one of this, the 300, this annual summary incident log is the one that has a CSV file format. One of that, I need to confirm that. But there's a CSV file format that matches the format that can be uploaded online for the OSHA reporting as well. So some of that information more detailed, of course, it's available in PeopleBooks, but there is ability to report individual or a periodic reporting or year-end reporting. All those options are available. So let me just quickly show you this example since I ran this report. Let's say that's the one today. Right? Let me pick this up. I don't have security. I sort of prepared for this eventuality, and let me pick up the report. Okay, so this is the 301 incident report, OSHA 301, and as you can see here, it comes pre-formatted. So the format is maintained by Oracle, part of the standard regulatory patching. And basically the information that is entered on that reporting page that we just saw, that gets entered into this page. The employee name, employee details, the address, what was the treatment, when it was received, and what happened, all the description information. So this is for that one particular incident. You can group it and create for multiple incidents at the same time. All right, so I just want to quickly go back to the slide deck. So we have a few more things to cover before we wrap up. But if you have any questions on the demo part, anything that you have seen there, please feel free to send the question. Even if we don't have time, please feel free to contact me via email as well. So the delivered reports I have included in the slide deck. There is a page around the delivered reports functionality. All right, let's quickly cover the deployment aspect. So in here, I would group the deployment into 4 sections. First, when it comes to the core module functionality, everything to us manage with an incident, everything to do with an incident, all of that is customer configuration that is listed in here. I pretty much have covered all of these items. There could be few other items as well. That would be part of the core module configurations. The second is, if you want to enable self-service capability, and which is the most important aspect we discussed today, then the setup associated with the self-service, as I showed you the incident setup page, is mandatory. But everything else apart from the incident setup, the activity guides, AWE, email templates, page and field configurator, drop zones, all those are optional. Some of the basic things, email templates and AWE, you may want to review. But if you want to extend it to do some things more, that's when you will talk about page and field configurator, drop zones, etc. And what are some of the common aspects, setups that needs to be done when it comes to permissionless roles to give the right security to the right users? If you want to set up the fluid user interface, tiles, homepage, dashboards for the admins and the employees, review and update the nav collection to make sure all the relevant links are included, any reports that you want to use, and in addition, if you want to build any analytics, those are the other items that you need to do. Not everything is mandatory, some of them are, like security and navigation. And then if you want to set up and use the health card feature, then you have additional setups to do, like allergy, immunization, diseases that you want to capture, etc. So these would be the 4 high-level groupings of the setup that would be needed. Now, there was one question about what is our service around this deployment. Now, as you have seen all of that, it's a pretty standard functionality that needs to go through step by step and set it up across. Now, what we are offering in here is essentially a service that comes with a lot of pre-built accelerators, starting with the selective patching, what bugs, what information you need from the latest images to be applied to your image to make sure you're able to use some of the latest features around self-services, assistance with patching, making sure we go through the whole business process and help you make the right business process decisions. Most importantly, the configuration workbooks. This is where I think there's a lot of time saving, where we come with pre-configured workbooks to collect all the setup details that we need from you, work with you, and essentially set up those things using Excel to CIs, load that information. And then the standard configurations around fluid user interface, approval, security, etc. All of that. That's typically not something that would vary with customers. The rules would vary, but the objects that are impacted would be exactly the same. So we will come pre-built with those offerings. And more importantly, the analytics that you saw there about incident summary, COVID tracking, etc., can be easily reused. Other items when it comes to deployment and change management, assistance with the job aids. We have pre-built job aids for the administrative and employee usage. Employees are pretty straightforward. It's the administrative side that would need job aids, so job aids for administrators, and supporting you throughout the process in terms of testing and production. Now, what our deployment process looks like, it can be as low as a 4-week process, where week 1 is essentially focused on selective patching, business process decisions, and filling up the configuration workbooks. Week 2, uploading the configurations, making sure the security and the other aspects are done right, and then week 3, 4 is testing and deployment. Depending upon how much you want to use, what is your current state of the application, how large is your operations, all of that would play into the overall final schedule, but it could be as short as a 4-week period deployment. In terms of the benefit of this offering, benefit of all of these accelerators is between a standard implementation where you follow a standard SDLC process to go through and gather requirements up until completion, between that approach and using all our accelerators and having a fixed timeline approach, the difference is by at least 50% you would save in terms of cost and effort to complete this deployment. With that, I see there are a few more questions to address that I will come to quickly. In this, as part of the slide deck, I have linked to various information. There is a very informative YouTube video that specifically talks about the self-service capability. There is blogs from Julie at Oracle and the PeopleSoft HCM team that talks about the responses to COVID, what are the functionalities that are getting released, plan enhancements and features. There is a work in progress items around Kibana analytics and dashboard that is specifically focused on health and safety, and manager functionality around health and safety. Those are the items that are going to be out next, and information about the regulatory aspects as well. So all this information for your reference. And finally, the contact information for any questions and feedback that you want to provide for the session today. With that, let me quickly address the new questions that we have in here. How do new customers migrate in various instances through DMS or to? Yes, I think we briefly covered that. New configuration doesn't matter whether you're updating an existing configuration or a new configuration. All of that get migrated using the various tools I said. It can be DMS, it can be migration workbench using application data sets. If you have more specific questions, we can definitely take it offline. In short, how the packaging will be done. Again, the packaging, when we talk about our deployment service, we already have pre-built scripts for migration of all these configurations from our implementation. So we start with that as a baseline. This probably covers 90% of the configurations. If a customer is doing on their own, then all those configuration tables needs to be identified and scripted, or some of these items like page and field configurator, approval workflow engines are coming with are delivered with standard application data sets for migration. So you could use any of that. Then so another question, can you set up multiple health and safety administrators that have responsibility over different areas, security by employee departments? That's a very good question. So what I see here is when it comes to health and safety management itself, there isn't a row-level security by incident type that's not delivered out of the box. But I would say using the security views, that's definitely possible. When it comes to managing by departments, employee information by departments, I can check and get back whether the delivered default row-level security that is department-driven applies for the incident pages. I'll make a note of that item and I will get back to you for that particular question. All right. I can't see the chat window in here, but these are all the questions I see on the questionnaire window, and we are right on time. Any other final questions from anyone before we wrap up? All right, all of you have a great rest of the day and week. And as I mentioned before, I will be sending out the handout of the presentation that was used today. And also the video recording of this presentation will be posted online. So feel free to share it across if anyone could not join today. And look forward for all of you joining our next presentation. Thank you very much. Have a great day.